The golden years should be a time of relaxation and enjoyment, but for a growing number of seniors, this period is shadowed by the increasing prevalence of diabetes. It's a silent epidemic creeping into the lives of older adults, often unnoticed until significant damage has already been done. The statistics are sobering, revealing a dramatic rise in diabetes diagnoses among those aged 65 and older. This isn't just a matter of numbers. It's a critical health concern demanding immediate attention. Why the urgency? Because early detection is paramount. Diabetes, when left unmanaged, can lead to a cascade of debilitating complications, drastically impacting quality of life. But the good news is that with timely intervention and proper management, seniors can effectively control their diabetes and live full, active lives. Understanding the subtle, often overlooked signs of diabetes is the first crucial step in this process. So, what exactly is this condition we're talking about? Diabetes, in its simplest form, is a disease where your body either doesn't make enough insulin or can't effectively use the insulin it produces. Insulin is a hormone that acts like a key, allowing sugar, glucose, from the food we eat to enter cells and provide them with energy. There are primarily three types: type 1, an autoimmune condition, gestational diabetes, which develops during pregnancy, and type 2, the most common form, especially among seniors. In type 2 diabetes, the body becomes resistant to insulin. This means the key doesn't work as well and glucose builds up in the bloodstream instead of fueling cells. This insulin resistance forces the pancreas to work harder, eventually leading to its failure to produce enough insulin, perpetuating the problem. But why are seniors particularly susceptible to developing type 2 diabetes? Several factors contribute to this increased vulnerability. As we age, our bodies undergo natural physiological changes. Kidney function often declines, impacting glucose regulation. Metabolism slows down, making it easier to gain weight, a significant risk factor for insulin resistance. Furthermore, seniors often have coexisting conditions like hypertension or cardiovascular disease, which can further impair insulin sensitivity. Lifestyle also plays a crucial role. Reduced physical activity and dietary habits developed over a lifetime can contribute to weight gain and insulin resistance. These combined factors create a perfect storm, making seniors prime targets for the development of diabetes. Now, let's delve into the heart of the matter: the silent signs of diabetes. What do we mean by silent? It's not that these symptoms are completely absent, but rather that they are often subtle and easily dismissed as simply part of the normal aging process. A little more tired than usual, probably just getting older. Needing to urinate more frequently. Must be the water pill. A wound taking longer to heal. It happens at this age. This tendency to attribute these changes to aging is what makes diabetes so insidious in seniors. Because these signs are often overlooked or misinterpreted, the disease can progress undetected for years, allowing significant damage to occur before a diagnosis is finally made. Recognizing these subtle clues is therefore crucial for early intervention. Point 1 of the first and often most overlooked signs is increased fatigue and weakness. Now, everyone feels tired from time to time, especially as they get older, but diabetic fatigue is different. It's a persistent, overwhelming sense of exhaustion that doesn't improve with rest. This type of fatigue stems from the fact that even though there's plenty of glucose in the bloodstream, it's not getting into the cells where it's needed for energy. Think of it like trying to start a car with a full gas tank but a broken fuel line. The fuel is there, but it can't reach the engine. This cellular starvation leaves individuals feeling constantly drained, even after a full night's sleep. This can manifest as difficulty performing everyday tasks or a general feeling of being weak and listless. Another common, yet easily dismissed sign is frequent urination, often accompanied by increased thirst. When blood sugar levels are high, the kidneys work overtime to filter out the excess glucose. This process draws fluid from the tissues, leading to more frequent trips to the bathroom. This is why individuals with undiagnosed diabetes often experience excessive thirst. Their bodies are trying to replenish the lost fluids. Pay particular attention to nocturnal urination or nocturia. Waking up multiple times during the night to urinate can be a significant indicator of elevated blood sugar, especially if it's a new or worsening symptom. It's more than just an inconvenience, it's a signal your body is sending that something is amiss. Another concerning sign is the presence of slow-healing wounds and frequent infections. High blood sugar levels impair both circulation and immune function. Poor circulation means that blood, carrying vital nutrients and oxygen, struggles to reach wounds, hindering the healing process. Simultaneously, elevated glucose weakens the immune system, making individuals more susceptible to bacterial and fungal infections. Foot ulcers are a particularly serious concern. Due to nerve damage, neuropathy, which we'll discuss later, and poor circulation, seniors with diabetes may not even feel minor cuts or blisters on their feet. These seemingly insignificant injuries can quickly become infected and, if left untreated, can lead to serious complications, including amputation. Vigilant foot care is therefore essential. Changes in vision, particularly blurred vision, can also be a subtle indicator of diabetes. High blood sugar levels can affect the lens of the eye, causing it to swell and distort vision. This blurring can fluctuate, sometimes improving and sometimes worsening, making it easy to dismiss as just a temporary issue. While age-related vision changes are common, sudden or unexplained blurring should never be ignored. More importantly, diabetes can lead to serious eye diseases like diabetic retinopathy, which can cause permanent vision loss. Therefore, regular comprehensive eye exams are absolutely crucial for seniors, especially those at risk for or diagnosed with diabetes. Early detection and treatment of diabetic eye disease can prevent significant vision impairment. Numbness or tingling in the hands and feet, known as peripheral neuropathy, is another significant warning sign. Prolonged high blood sugar levels can damage nerves, particularly those in the extremities. This damage can manifest as a tingling, prickling, or burning sensation, or even complete numbness. This loss of sensation can be particularly dangerous for seniors. They may not feel injuries to their feet, increasing the risk of undetected wounds and infections as previously discussed. Furthermore, neuropathy can affect balance and coordination, significantly increasing the risk of falls and subsequent injuries. That it's crucial to report any new or worsening numbness or tingling to a healthcare professional. Perhaps less commonly recognized, but equally important, are the potential cognitive changes associated with diabetes. Studies have shown a link between diabetes and an increased risk of memory problems, confusion, and even dementia. High blood sugar levels can damage blood vessels in the brain, impairing cognitive function. These cognitive changes can manifest in various ways, such as difficulty remembering names or recent events, trouble concentrating, or feeling generally confused. These symptoms can significantly impact daily life, making it difficult to manage medications, handle finances, or even perform simple tasks. It's important to note that cognitive decline is not an inevitable part of aging, and diabetes may be a contributing factor. Don't overlook changes to the skin, as they can also be indicative of underlying diabetes. One specific sign is acanthosis nigricans, characterized by dark, velvety patches of skin, often appearing in the folds of the neck, armpits, or groin. This condition is often associated with insulin resistance. Furthermore, high blood sugar can lead to dry, itchy skin, making seniors more prone to skin infections. Elevated glucose levels also create a favorable environment for fungal infections, such as yeast infections and athlete's foot. If you notice any unusual skin changes, particularly if they are accompanied by itching or discomfort, it's worth discussing with your doctor to rule out diabetes or other underlying conditions. Finally, it's important to recognize the potential impact of diabetes on mood. Fluctuating blood sugar levels can contribute to irritability, depression, and anxiety. These mood changes can be subtle and easily attributed to other factors such as stress or loneliness, particularly in seniors. However, it's important to consider that these mood disturbances may be linked to underlying blood sugar imbalances. The brain relies on a steady supply of glucose for proper functioning, and when blood sugar levels swing erratically, it can disrupt neurotransmitter balance, leading to mood instability. If you or a loved one experiences persistent mood changes, especially in conjunction with other potential diabetes symptoms, it's worth discussing with a healthcare professional. Given the insidious nature of diabetes and the subtlety of its early signs, regular screening is absolutely essential, particularly for seniors. Current guidelines generally recommend that all adults aged 45 and older be screened for diabetes every 3 years. However, seniors with risk factors, such as a family history of diabetes, obesity, or high blood pressure, should be screened more frequently. The HbA1c test is a common diagnostic tool that provides an average of blood sugar levels over the past 2 to 3 months. Other tests include fasting plasma glucose and oral glucose tolerance tests. Talk to your doctor about which screening method is best for you and how often you should be tested, based on your individual risk factors. Whether you're trying to prevent diabetes or manage an existing diagnosis, lifestyle modifications are absolutely crucial. Diet, exercise, and weight management are powerful tools that can significantly impact blood sugar control. Focus on a balanced diet rich in fruits, vegetables, and whole grains, while limiting processed foods, sugary drinks, and saturated fats. Regular physical activity, even moderate exercise like walking or swimming, can improve insulin sensitivity and help maintain a healthy weight. Losing even a small amount of weight can make a big difference in blood sugar control. Consult with a registered dietitian or certified diabetes educator for personalized guidance on diet and exercise plans that are safe and effective for seniors. When lifestyle modifications alone aren't enough to manage blood sugar levels, medication becomes necessary. There are various types of diabetes medications available, each working in different ways to lower blood sugar. Some medications help the body produce more insulin, while others improve insulin sensitivity or reduce glucose production by the liver. In some cases, insulin therapy is required, especially if the pancreas is no longer able to produce sufficient insulin. Insulin is administered through injections or an insulin pump. Regardless of the medication prescribed, adherence is absolutely crucial. Taking medications as directed and consistently monitoring blood sugar levels are essential for effective diabetes management and preventing complications. It's crucial to understand the potential consequences of untreated or poorly managed diabetes. The complications can be severe and life-altering. These include heart disease and stroke, as high blood sugar damages blood vessels, increasing the risk of cardiovascular events. Kidney disease, or nephropathy, can lead to kidney failure and the need for dialysis. Vision loss, including blindness, can result from diabetic retinopathy. And as we've discussed, nerve damage or neuropathy can cause pain, numbness, and increased risk of foot ulcers and amputations. These complications underscore the importance of early detection and proactive management. While diabetes can be a challenging condition, effective treatment can significantly reduce the risk of these devastating outcomes. Family members and caregivers play a vital role in the early detection and management of diabetes in seniors. Because seniors may not always recognize or report subtle symptoms, caregivers can be instrumental in noticing changes and prompting medical evaluation. Caregivers can also help promote healthy habits, such as preparing nutritious meals, encouraging physical activity, and ensuring medication adherence. They can also assist with blood sugar monitoring and foot care. By working together, seniors, their families, and healthcare professionals can create a supportive environment that promotes optimal diabetes management and improves overall quality of life. It's also important to address some common myths and misconceptions surrounding diabetes in seniors. Point 1 myth is that diabetes is simply a natural part of aging. While the risk does increase with age, it's not inevitable. Another misconception is that a diabetes diagnosis means a life of deprivation and suffering. With proper management, individuals with diabetes can live full and active lives. Some seniors fear insulin injections, but modern insulin delivery systems are often painless and easy to use. Furthermore, many believe that only sweets cause diabetes. While sugar does play a role, the overall diet, including portion sizes and carbohydrate intake, is more significant. Debunking these myths can help seniors feel more empowered and less fearful about managing their health. Navigating a diabetes diagnosis can feel overwhelming, but remember, you're not alone. Numerous resources and support systems are available. Reliable information can be found on websites from organizations like the American Diabetes Association, ADA, and the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. Consider joining a diabetes support group, either in person or online, to connect with others facing similar challenges. Look for healthcare professionals specializing in geriatric diabetes care, including endocrinologists, certified diabetes educators, and registered dietitians. These experts can provide personalized guidance and support to help seniors effectively manage their diabetes and maintain a high quality of life. In conclusion, while diabetes poses a significant health challenge for seniors, it's not a sentence to a diminished quality of life. The key takeaway is the critical importance of early detection, being aware of the subtle, often silent, signs of diabetes, and by promoting regular screening, we can identify the condition early on and prevent serious complications. Proactive management through lifestyle modifications, medication adherence, and ongoing support is equally vital. With the right tools and resources, seniors can effectively manage their diabetes and continue to live long, healthy, and fulfilling lives. Don't let diabetes silence your golden years. Take control and embrace a future of well-being.